Hi, this is Amy Wilhelmy, and this is Healing is a Messy Bitch. Today we're going to talk about EMDR and queer trauma. So one trauma therapy that can be incredibly helpful here is EMDR, and this stands for Eye Movement Desensitization Reprocessing. That's a mouthful, right? Eye movement desensitization reprocessing is developed by psychologist Francine Shapiro. And EMDR works by helping the brain reprocess distressing memories. Sometimes traumatic memories get stuck in the brain's information processing system, and they stay emotionally charged long after the event is over. And EMDR uses bilateral stimulation, things like guided eye movements or tapping, to help the brain integrate those memories. So for LGBTQ plus clients, EMDR might be used to process experiences like bullying, family rejection, religious trauma, coming out experiences that weren't great, that might be painful. And these memories often carry beliefs like, I'm not safe, I'm wrong, I don't belong. And EMDR can help shift those beliefs into something more accurate and compassionate. Attachment and relationships are another powerful therapy model. So here is emotionally focused therapy. It's often called EFT. EFT was developed by psychologist Sue Johnson. EFT is based on attachment theory, and this was originally developed by psychologist John Bowlby. Attachment theory basically says that human beings are wired for emotional connection. We need safe relationships in order to regulate our nervous systems. So when relationships feel unsafe, our brains panic, which can lead to patterns like withdrawal, criticism, emotional shutdown, conflict cycles. For LGBTQ plus clients, these patterns can sometimes be intensified by outside stress and things like family rejection, social stigma, legal barriers, or simply feeling unseen by the larger culture. EFT helps couples understand the emotional needs underneath those conflict patterns. Instead of, you never listened to me, the deeper emotional message might be, I'm scared of losing you. When couples can express these vulnerable feelings safely, relationships often shift dramatically. Another piece of affirming therapy involves sex therapy. Now, historically, sex therapy has often been built around heterosexual norms, which means that LGBTQ plus clients sometimes encounter therapy that doesn't fully reflect their experiences. Affirming sex therapy recognizes that sexuality exists across a spectrum. There is no single normal way to experience intimacy. And for some clients, especially those with trauma, therapy may also involve reconnecting with the body. Trauma can create disconnection from body sensations, and people might feel numb or anxious or detached during intimacy. Trauma-informed sex therapy uses techniques like sensate focus. Sensate focus was developed by sex researchers Masters and Johnson. Sensate focus involves slow, mindful exploration of touch without pressure or performance goals. The goal is to rebuild safety and awareness in the body. And when therapy is affirming, clients can explore what that process feels like without judgment. Here's an important piece for therapists watching this. Affirming care requires self-reflection. Even well-intentioned clinicians grow up in cultural systems that shape our assumptions. So part of ethical practice is examining those assumptions. Affirming therapists commit to things like using correct names and pronouns, avoiding pathologizing language, staying open to learning from clients' experiences. Clients should never have to educate their therapist about basic respect. That responsibility belongs to the therapist. When therapy integrates trauma work, relational work, and identity affirmation, it creates space for something really powerful. Clients can begin to experience their identity not as a source of danger, but as a source of authenticity and connection. And that shift can change everything. If there's one thing I want people to take away from today's conversation, it's this. Affirming therapy is not just about saying the right words. It's about creating a therapeutic environment where people feel fully seen and respected, where identity is not treated as a problem to solve, but as an important part of who someone is, because healing happens when people feel safe enough to be themselves. Next week, we're going to talk about something that sounds a little technical, but it's actually really fascinating. Informed consent in altered states of consciousness, specifically when we're working with therapies like ketamine-assisted psychotherapy. Because when therapy involves altered states, ethics and consent become even more important. And that conversation is a good one. So I'll see you then. Thank you.